name is Diana. I'm a freelance journalist, and I'm here today with Michelle Davey, the CEO and co-founder of Wheel. So, Michelle, why don't you start off just by telling us a little bit about Wheel, its business model, and what sets your company apart from all the other ones in the telehealth space?
Yeah, thanks for having me, Diane. So at Wheel, we're building the infrastructure for virtual care. So on our platform, we make it easy for clinicians to find jobs and work in virtual care and enable companies to scale uh, their virtual care delivery nationwide. So we're the first and only platform that is a turnkey solution to scaling those services, and then having the clinicians and clinical network attached.
Right. And so earlier this year, Wheel raised close to 14 million in a Series A financing round. Can you tell us a little bit about that? Tell us a bit about your investors.
Yeah, absolutely. So CRV led our round, and we're excited to partner with them due to their deep healthcare experience in both traditional healthcare and digital health. We also have Test Ventures in our round, who is well known from their regulatory strategy. They keep us kind of front and center of the regulatory changes that are coming down the pipeline. And then we also have Silverton Partners, who's a Texas based investor who helps us with local talent and also guidance around marketplaces from that side.
Mm-hmm. And I guess this year has been a special one. I guess given COVID-19, I don't know if special's the best word for that, but COVID-19, I guess one positive impact it has had is that it's really rapidly accelerated the expansion of telehealth. What impact has this had on Wheel?
Yeah, so COVID is definitely been an acceleration for the industry overall. So more patient demand coming in, but as well more clinicians to fill that. So I think from Wheels' perspective, it hasn't changed our business model, but really solidified it.
Mm-hmm.
For us, it's been always about bringing clinicians and enabling them to practice the highest quality virtual care in the space. And so bringing them in to meet that patient demand. And then more importantly, how we're engaging them to meet the right patient at the right time. And that's really been the core of what we do here at Wheel. And so COVID has just allowed us to expand on that model through different types of virtual care companies. And really, over the last 7 months, we've really innovated quicker and faster than we have in the last 10 years combined as an industry. So excited about the momentum that's happening on that side.
Mm-hmm. Mm-hmm. And this rapid pivot has also, meant that doctors have to quickly adapt to working in this digital environment. How have you been helping physicians deal with this, fast shift?
Yeah. So, as you mentioned, with this rapid acceleration from the patient demand, it's more important than ever that we're bringing the right clinicians in to service the patients coming in. And so, from the clinician perspective, you know, it's important to remember that they never received virtual care training formally in their formal training. And so, what Wheel does, our platform actually trains clinicians on all things virtual care. Everything from specific treatment areas and clinical protocols to website manner, to ensure that the patients have a safe, high quality, but also great experience in virtual care. And so Wheel is clinicians are trained and ready to serve patients with the highest quality of virtual care because of our platform's ability to train them efficiently.
Mm-hmm. And I guess one of the concerns about telemedicine has been whether virtual care can truly emulate in-person care. How does Wheel ensure that clinicians are able to provide high quality care that matches or surpasses what people have been getting in the past?
Yeah. So I think it's important here to think about in-person care first, and just bringing that online is not innovation. So a lot of people are unhappy with the traditional system, both patients and providers. So, what we do here at Wheel is really to bring a better experience to virtual care. So, if we're just emulating the broken system, we don't find that as innovative as if we reconfigure the way clinicians are working and really make them happier so that we can have healthier patients. And so, ways that we do that. Um, we find the best of the best clinicians. So only 1 in 10 clinicians who apply to the Wheel platform are brought in. They then go through rigorous interviewing and training processes. And we make sure that they're board certified and can meet our NCQA standards for credentialing. And then we train them heavily. And then lastly, we ensure the quality pieces by making sure that using data and analytics, we can see, how they're prescribing or not prescribing, how they're taking care of patients, those patient outcomes, and that website manner score. So we look at everything across the board from clinical process quality to website manner quality and how the patients are engaging from that side.
So I guess there's this kind of two-step process in addition to, like, on one hand you're screening, and then on the other hand you're kind of monitoring to make sure that that care level remains high.
Exactly. Yeah. So the first side of it is really important to ensure that you're getting the right types of clinicians and training them so that they are prepared and ready to practice in virtual care. And the second side of that is making sure they have the ongoing training and education to keep up with the evolving industry.
Mm-hmm. Mm-hmm. Um, and I guess no matter how good virtual care gets, at this point there are still things that you really need to be in person, or perhaps it's still easier to be in person to deliver that care. What are some areas where you would say that transitioning to virtual care still remains a bit of a challenge?
Yeah, so pre-COVID, telemedicine was primarily used for urgent care needs, more episodic care. Then early in COVID, we saw the transition into more kind of education and triage. What we've seen now happening is really, those areas that, you know, particularly most people would say is not used for virtual care. For instance, surgery is a good example of that. There's still applications for virtual care in that. So pre-op and post-op opportunities where patients can follow up with clinicians. So there's a lot of areas that virtual care and telemedicine can apply to really take care of the patients at home, whether that's applications in telehealth, or bringing on diagnostics or remote patient monitoring so that those areas that may not seem obvious as virtual care can take care of the patients in those disease states or treatment areas, we can really start to maybe not completely take over, what can be done in person, but we can surely assess and monitor patients more actively so that when they are coming in and when patients are coming in, the people who need to see the surgeons and the doctors are the ones getting the treatment that they need in a timely manner.
Mm-hmm. Mm-hmm. And when it comes to some of these more challenging areas, what kind of innovations do you think are necessary or could be useful for telemedicine to kind of expand their offerings in the future?
Yeah, so going back to the remote patient monitoring and the diagnostics, I think telehealth is just kind of that front door of healthcare. And so bringing in, you know, patients in different disease states, the really closing that loop and taking care of patients over time is really about how do we then start to diagnose, whether through diagnostics and lab testing, but also monitoring those patients. So that's where remote patient monitoring is up and coming. Really around how do we monitor that, but connect it to the clinicians so that the clinicians can have a full picture of how patients are doing at home or throughout their day, and then be able to help patients make either incremental changes or large changes to take care of them where they're at and meeting the patient where they're at.
Mm-hmm. Mm-hmm. And pivoting from the patient perspective to like the clinician perspective, under Wheel's model, clinicians can work for as many companies as I want. How do you ensure that clinicians remain satisfied with the companies that they're working with?
Yeah. So clinician happiness is something that we take very serious here at Wheel. It is fundamental to our business. So we measure their happiness throughout the patient experience. So I think from everything from how are they interacting with Wheel and virtual care to that education component. So our education goes deeper than just our virtual care protocols and our website manner, but also enables them to work and receive that training in a way where they're most comfortable. So at their home or their office, um, as well. Just measurement. I think of just making sure that the good feedback from patients and the outcomes are getting um, back to the clinician is really important for them. Clinicians, go into this to help patients, and our goal here at Wheel is to remove the barriers from them so that they can focus on what they went into medicine for, which is providing high quality care.
Mm-hmm.
And so, in that, we enable them to give us feedback as well so that we can iterate on our processes, but also service the patients in a way where they can really provide high quality, valued care to the patient.
Mm-hmm. And what about on the legal side? What do you do to ensure that clinicians are protected from things like malpractice suits or other kinds of legal challenges?
Yeah, so malpractice we provide to all of our clinicians, but that's in the worst case scenario. So, one of
Mm-hmm.
the things that we do here at Wheel is work very closely with our clients to ensure regulatory compliance as well as clinical compliance and really just setting that standard for care. And so our teams do that, but we've also built regulations into our platform. So we ensure that the patients are protected, but also the clinicians by having a high standard for our regulatory world and making sure that the patient is seeing the right doctor at the right time on demand. And so building that into our technology is really how we ensure, both from the client perspective, that they're regulatory safe and checking all the boxes, but then in return protects our clinicians because it is their licensure and livelihood on the line. And so we want to make sure that they are protected and that they're only practicing with the best of the best companies, and that
Mm-hmm.
we're protecting them from those that aren't practicing good healthcare and good medicine.
Mm-hmm. And on the point about regulations, these state by state regulations around things like licensing have been one of the kind of key obstacles in the way of scaling up telemedicine. Can you tell us a bit about what Wheel does to navigate this complicated regulatory environment?
Yeah, so navigating regulations has been at Wheel from the beginning. My co-founder Griffin is a health regulatory lawyer, and so we solved the regulatory complexity by building that into our technology. So companies no longer have to worry about these barriers. For example, you can think about scaling clinical capacity 24/7 across all 50 states is a massive operational and regulatory hurdle. And so our platform solves this by allowing clients to easily plug in and are routing every consult to the best clinician. So you can think of our marketplace as kind of this nationwide Uber where we're kind of routing patients to the best trained licensed clinicians within their state on demand.
Mm-hmm. Right. And now I want to talk a little bit about costs. So, whether telemedicine actually reduces medical spending has been a matter of debate. What do you think companies in the telemedicine space should do to try and really reduce the cost of care?
Yeah, so that's the really important piece about Wheel is clients here at Wheel are only paying for the time that that clinician is utilized with their patient, and so in return, the clients can not have to staff and overstaff clinicians, which is a really expensive part of healthcare, and then pass the savings along to the patient. So we believe by people using Wheel, we're able to lower their operational headcount cost, both from a clinician perspective as well as operational, and pass that savings along to the end user, who's the patient. As well, there's a lot of things coming out in telemedicine about how are we reimbursing for quality care, and Wheels working right now on how we do that for telemedicine and virtual care.
Hmm. Can you tell us a little bit more about the reimbursement angle? Like, what are some things that are being considered in that with regards to reimbursement?
Yeah, so I think it is, really been in the light of COVID. We've seen CMS come down and say, telemedicine can receive pay parity to in-person care. And so what we're
Hmm.
doing now at Wheel is looking at those areas in which we can help our clients reimburse for, and then enable our clients to easily reimburse for those services over time and receive pay for those, so that the patient isn't having to pay out of pocket every single time.
Hmm.
In the world that there's still cash pay, it is important to note that most of the time the cash pay models still are cheaper than in-person care, and even a co-payment sometimes with their insurance. So we're weighing both options, and really making sure that the outcomes for the patient is still low cost, affordable, high quality care.
Hmm. Hmm. And I guess going back to this idea of pandemic related interest in telemedicine, even though the pandemic, really led to this huge spike in telemedicine visits early on, there's been some reports that there's a bit of a drop off in virtual visits, now that things aren't as bad as they were in the spring. What do you think telehealth companies need to do in order to keep patient interest in telemedicine high, once the pandemic is, really over and we can go back to being in person without worrying about the coronavirus?
Yeah. So I think there's a couple things from that side. I think, we are starting to see a decline in COVID related telemedicine, because as I mentioned earlier, that was mainly around triage and education, and just making sure, patients felt comfortable early on with, if they were experiencing symptoms, where care navigation, where they could go to get help. So we have seen a decline over that, because I think the general public is more aware of those symptoms and where they can receive care for COVID. I think what we're starting to see more of is longitudinal care. How are we taking care of patients at home, for chronic care conditions like diabetes and COPD, but other disease states as well? So while we're seeing a decline of the triage and education and really around COVID related specific episodic care, we're seeing an increase in other areas. So higher acuity areas, longitudinal care, and really seeing that innovation of remote patient monitoring, diagnostics start to enter the space, so that we can really take care of those patients where they're at.
Hmm.
And that we are actually seeing an increase of, and I suspect that we'll continue to see that. Um,
Hmm.
when and if COVID is over and we can go back to in-person care, I
Right.
think it's less about, doing that safely. It's more about how does innovation allow us to meet the patient where they're at, and not have to give them the experience of going back into the office, or the hospital. If they are going into that for their needs, we want to make sure those patients are front and center, so that the hospitals and the practices can take care of the sickest of the sickest, and not kind of the worried well that we can treat at home.
Right, right. And with regards to patient uptake, one of the groups that's been, I guess, most resistant to the use of telemedicine has been older adults. And, we're seeing an increase of older Americans using telemedicine because of COVID, but there's still some barriers like privacy concerns and comfort levels with technology. What kind of things do you think are needed to, really increase the uptake within this specific age group?
First and foremost, I think it's ease of access, right? So my grandmother can access Facebook regularly, but oftentimes healthcare applications make it difficult for the patient, especially aging population, to access their applications, whether that's on a phone or on their laptop. So I think first starting out with making it easy to start those interactions. The next step is how do we also build in opportunities for their care teams? So, oftentimes these aging populations have, whether that's a son or daughter taking care of them, or extended family member, or even an outside care team member. How are we engaging them in their healthcare as well, and making it possible for everybody on that care team to be informed? And so telemedicine has a really big opportunity there to help the aging population age in place,
Mhm.
as well as inform their care teams over time.
Mhm. Mhm. All right. Well, great. Thank you so much. And now that we only have a few minutes left, we'll end this discussion with a little game called Overrated, Underrated. And for this game, I'm going to share with you a few terms, and you can let me know whether you think they're overrated or underrated, and a little bit about why you think that is. So the first thing is telemedicine chatbots.
Yeah, so I think currently, let me think about that. Currently overrated. I think chatbots can do a lot as far as symptom checking and ensure that the clinician, once they're on with the patient, has the right information. But I think, at least yet, we haven't seen the application where they're really enabling some of that early, kind of triage or care navigation.
Mm-hmm.
Uh, but I do believe in the potential to do that. And it is really helpful for our clinicians to have that information from chatbots early so that they can see the patient's history and then provide good quality care when they're in the patient visit with them.
Mm-hmm. Mm-hmm. Great. The second term is doctor on demand.
The company or the term?
The company. Sorry.
um, that was currently underrated. I think Doctor on Demand has paved the way in a number of areas, including antibiotic resistance and kind of their policies around that.
Mhm.
There's a lot of things happening in this space, so I'm excited to watch what happens with Doctor on Demand in the coming months.
Great. And the last thing is big tech in healthcare.
Uh, Currently underrated. I think there's a lot of innovation big tech can bring to healthcare. There's Google investing into Amwell, Amazon, having a number of opportunities in this space. So I'm very excited to see what happens, and believe that companies like that can bring the innovation that they found in other industries and apply it to healthcare.
Mhm. All right. Well, thank you so much, Michelle. It was a pleasure speaking with you today.